Hi friends, welcome to GeriTips. This week we're discussing chronic venous insufficiency. Chronic venous insufficiency includes medical conditions such as the spider veins that we see, to varicose veins, to those dark areas of skin in the lower extremities, and then sometimes person will develop venous ulceration on the legs in extreme cases. So we'll be discussing ways to avoid these changes where possible, and treatment options as well. I couldn't find any options in terms of reversal of these changes naturally. So but let's see if the information here is helpful to you. All right, so we're discussing chronic venous insufficiency. We've discussed changes of the cardiovascular system with age, hypertension, heart failure, coronary artery disease, arrhythmia, and peripheral arterial disease. So uh, we'll just be discussing the Jerry stats, Jerry facts, and Jerry trivia. I apologize for the typo on this slide. So chronic venous insufficiency, it's fairly common where many of us will have some type of venous changes in our legs, whether it be spider veins, whether it be varicose veins, or maybe some skin darkening, which becomes more prevalent with age. Uh, the good thing is that most persons don't have symptoms. Most persons will have cosmetic concerns, how they look, and thankfully there are treatment options. But there are things that can be done to prevent these changes from happening. And then finally, did you know that giraffes, even though they're tall and they stand a lot, do not have varicose veins because the walls of their veins are super strong to prevent excessive dilatation. So just wanted to share that with you. So chronic venous insufficiency is defined as the changes that result from chronic venous reflux and venous hypertension, mostly noted in the lower extremities. And in terms of chronic venous insufficiency risk factors, the older we get, the increased chances of having chronic venous insufficiency, a family history. Also, if your parents have had, or if your parents have or had long, uh, varicose veins or venous changes in the legs, you probably may have an increased chance of getting that. Ligamentous laxity, like your person with flexible joints, flexible skin, will tend to have varicose veins. Prolonged standing, prolonged sitting, increased weight compared to height, cigarette smoking, a common culprit in cardiovascular disease, a history of trauma to the lower extremity, prior clots in the legs, in the veins. If you are pregnant or for whatever reason you have a high estrogen state, and in rare cases, hereditary conditions can increase your risk of having chronic venous insufficiency. Now, uh, just to remind you guys um, of the changes that occur with aging. So, um, Well, so what happens is that deoxygenated blood goes to the heart, and then the heart pumps the blood to the lungs, and then the lungs deliver oxygen to the blood, and then that blood, which now has oxygen, goes back to the heart, the left side of the heart, and the left side of the heart pumps the blood to the rest of the body, and they eventually get to the legs. That blood gets to the legs. And then the muscles of the legs, the muscles and the tissues of the legs, the muscles, the nerves, like, etc. We use the oxygen in the blood, and then what remains in terms of the deoxygenated blood is pumped in veins back up to the heart. Now, there are there are valves in the veins that ensure that blood only travels in one direction against gravity, in most cases back up to the heart. Chronic venous insufficiency can occur when one, the veins don't the the valves don't work, so there's reflux, there's backflow of blood back down into the veins, which causes dilatation of the veins. Two, if there's damage to the vein itself. Three, if there's a clot in the vein and there's too much pressure behind the clot and that dilates the vein itself. And then estrogen will increase the will increase the size of veins naturally. So and then prolonged sitting also will increase the pressure within the venous system of the legs. So these are so this is the background behind what could set someone up for chronic venous insufficiency. So thought I'd take the time to explain that. So anyway, so when someone has chronic venous insufficiency, apart from the appearance of the veins in the legs, most persons don't have any other symptoms. And the concern usually is cosmetic. But for those who do have symptoms, they may have pain, heaviness in the legs, swelling, tightness, itchiness around the veins, irritation, even muscle cramps, and also there may be bleeding from the veins, especially if the vein is over bony prominence, skin discoloration. The area may not even have veins, but you can notice there's a darkening around the leg, on both legs, and then in advanced cases the skin breaks and then an ulcer forms. Uh, so on physical exam you might see some little spider veins. We call them, but the medical term would be telangiectasias, and then larger veins may emerge, varicose, which we call varicose veins, and then you might person with chronic venous insufficiency may then develop leg swelling, and then other changes in the skin like the darkening of the skin, and then as mentioned before, the skin will ulcerate. So, and then for those persons who are interested in the medical diagnosis of this, it's one of the tests that can be done is a ultrasound of the legs to see um, how much backflow there is in the veins of the legs. And then in terms of treatment, we want to educate patients that medically there's no increased risk of any complications from the varicose veins and the spider veins. But for the venous ulcers, there has to be some plan in terms of wound care. But for those persons who would like to treat the varicose veins for cosmetic reasons, insurances tend to prefer to cover varicose veins if there's a complication like bleeding or pain. But if there is a desire to treat cosmetically, there are treatment options, but they tend to be out of pocket for the patient. And so, in other words, the patient would have to pay for these treatment options. And in terms of treatment options, there are surgical and non-surgical options. Non-surgical options include avoiding prolonged sitting and standing, wearing compression stockings that are appropriately sized, meticulous skincare, and avoiding tight clothing. And then in terms of surgical treatment, there's venous ablation, where the vein is removed either with the use of heat or without the use of heat. The use of heat involves the use of radio frequency energy, laser light, even steam can be used. Non-thermal options include like actually pulling the vein out, or actually using glue or foam to ablate the vein, and then you could actually do surgery to really strip the saphenous vein, which is the main vein in the lower extremity. So those are the treatment options in a nutshell. So to summarize, to avoid chronic venous insufficiency, try to avoid sitting for a long time, try to avoid standing for a long time. So so as Bob Marley says, I gotta keep on moving. So essentially moving as much as possible, walking when you can, jogging when you can. That's really the way that to avoid chronic venous insufficiency. Um, particular skincare is helpful in terms of trying to avoid dry skin, things that can increase the risk of skin breakage, using moisturizing lotions, Vaseline to protect the skin. Avoiding tobacco and alcohol is always a safe bet. Weight loss is helpful, and as mentioned before, regular exercise and use of the calf muscles. So that's it for today's presentation. Check out healthinaging.org, the American Heart Association, the CDC, and the National Institute on Aging. Thank you for your time, my friends, and have a wonderful day. Bye bye.